Hey everyone, welcome to this special guest episode with Dr. Jordan Brenner. Dr. Brenner is a general dentist that began incorporating functional therapy in his office after it significantly helped his son. In this episode, we touch on some research linking the craniocervical junction, where I specialize, to how it affects the TMJ joint. And Dr. Brenner gives us his personal experience on the importance of the jaw and mouth in regards to our health, and how it has directed the evolution of his practice. I hope you enjoy. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. These research reviews, interviews, and episodes are made for you, whether you're a medical doctor, patient, or concerned family member or friend. The goal of these shows is to bring awareness of the importance of taking care of our spine and the impact it has on our health and the hundreds of different health conditions it could cause without us realizing it. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support. Now on to the show. Okay, welcome back everyone to the Upper Cervical Chiropractic Research Show. This is episode 10D. So this is the fourth episode that I've done with this research paper. I'm Dr. Kevin Leach. I'm here with a good friend and colleague, Dr. Jordan Brenner. He is a dentist. How are you, sir?
I'm doing well today. Just happy to be back at work.
Awesome. Yes, as are a lot of people that are able to go back. All right, so this episode, again, just for the people that haven't seen the other episodes, the paper is titled Relationship Between Craniocervical Orientation and Center of Force of Occlusion in Adults. And this is by Curtis Westersund, Jeffrey Scholten, and Raymond Turner, published in the Journal of Craniomandibular and Sleep Practices. And just for a real quick summary, for the people, again, who haven't seen the other episodes, the point of the paper was pretty much to see if, what was observed with doing NUCA before and after as far as occlusion. And they did that with a device called the Tscan, and I'll ask Dr. Brenner about that in a little bit here. But what they found was that it definitely did affect it, and actually an interesting result that they did found was it actually made it worse, which was in like 2 of the 12 or something, which was interesting. But there's, I have my theories of why that could have been and why they could have observed that. But so that was the gist of the paper. I got Dr. Brenner to read it, and he's going to give us our thoughts. So, Doc, what would you say, just kind of 50,000-foot overview? What are your thoughts on the paper?
I think the most important thing to take from it is that clearly there is a relationship between the two. And the fact that you see some people get worse and some people not, or some people get better, shows you that you can't treat just bite or just the upper cervical. You need to be aware that if you do something to one, you may affect the other.
Awesome. I agree. What would you say, and I've got my opinions and thoughts and hypotheses, but what would you say for the ones where they saw a worse scan after the alignment, so an improvement in posture, but then a worse T-scan afterward? What are your thoughts of what's going on there?
To me, it's likely that function always wins. Meaning that we have to be able to chew and eat our food in order to survive. So if you're out of alignment, there's something wrong with your neck, your upper cervical area, your body's going to find a way to adapt to chew and function.
Right.
Now, you correct that alignment issue, and all of a sudden their function changes. Well, they were functioning properly because they needed to survive.
Right. Or the function adapted to whatever position they were in. You fix that adaptation, and then it's not just going to go back to zero and normal. It's going to be and now it has to adapt again.
Right.
Yeah. Yeah. Awesome. All right. So will you tell us a little bit about the Tscan? Do you know do you use it? Is there newer technology? Is there older technology? Like what's the Tscan all about?
So the Tscan is essentially a way to check your bite, but not just that, the old carbon paper that you bite on. You have a filling done or you have a crown done, and they say, here, tap on this. And we look for these little marks on the paper to see where your teeth are coming together. Well, that's great, except it doesn't tell us when they came together. It doesn't tell us the force at which they came together. And those marks can be misleading because you don't know which one is artifact, which one isn't. And so what the Tscan allows us to do, though, is actually see all of that information in real time. It is like a 3D image of your bite. It's telling us, but it's also telling us the timing of everything.
Right. Awesome. Cool. Do you use something like that in your practice?
So I do have the Tscan in my office, and for simple cases, it's not always needed, but it's a tool that I have available, especially when there's something that we can't just simply solve.
Right. Now, so I know you've been steering your practice more and more on the functional side and on the, less on teeth, but more on kind of function, myofascial development. What's been your progression in gearing more toward that, and how did you come to that decision, and why are you focusing more on that now?
Well, one of the main reasons that I'm focusing on the developmental aspect and how we function is my son had a sleep breathing disorder, and we saw some behavioral things going on with him, and we needed to figure out how to best treat him. And so I started looking at different treatment modalities, and airway development is hugely important in a developing child. So it was really seeing the difficulties we were having and trying to get him the best help we possibly could, because I didn't want to go down the path of when he got older that he was just put on medication because he was a rambunctious hyper kid.
Right.
Well, a lot of the things that we started to see with his treatment is his outbursts are minimized or have gone away in a lot of things. So it really became my passion to find a way to help him and then help others struggling with similar issues.
Nice. So are you seeing a lot of pediatrics in your practice in regards to that, or just all across the board?
It's a growing part of my practice that originally I wasn't something that when I first started, I wasn't doing it. We saw some kids, but it's grown to this area that we can do it in adults too. The difference for adults is it typically manifests as sleep apnea. So you're tired all the time. So it's something that I'm working towards creating more of my niche practice.
Got it. What would you say to parents out there that are either interested in this, or maybe they see some of the same things with their children, besides coming to see a doctor, obviously, that does what you're doing? What could they do on their own, would you recommend, to encourage normal development, so that these things don't happen? Like what would you say that maybe what would be the cause of what your son went through, and could you have done something different in hindsight?
One of the problems that we all suffer from right now is cooked foods. It's good. Believe me, I love food and I'm a bit of a foodie, but with the advent of cooked foods, our diet got softer. So our jaws started developing improperly. You take in as well the added inflammatory processes from allergens, pollutants, and then you're not breathing through your nose. Well, if you're not breathing through your nose and you start breathing through your mouth all the time, your midface doesn't develop properly either. So it's taking things like that into consideration and figuring out, okay, how do we make sure that people are adequately breathing through their nose? Because as humans, we are meant to be nasal breathers,
Right.
not mouth breathers.
Right. Of course. So what would you say, now besides the cooked food, would you say other things dietary related would be affected? Like,
There's some evidence that, and some links, but there still needs to be more research on it. But things that are common to cause sensitivities, such as dairy.
right.
If you have a child that has has some of those symptoms or signs or symptoms of ADHD, having a food sensitivity check would be recommended, because you may find out that they have some food sensitivities you were unaware of.
Interesting. You know, I can remember, this is crazy to think about, but I remember when I went to school as a kid. I mean, our staples in the house were bread and milk, right? Oh, I mean, we went through that, and you might have too, from Iowa, right? So, I mean, you went through, and I remember every single day I would have to take a wad of tissues to school because I knew I'd be blowing my nose the entire time. And it turns out later in life, it didn't affect me in that way. It changed into actually skin stuff. So my skin would break out. So I don't eat dairy anymore. And when I do, my skin breaks out. So it's crazy to think about just how much, what was I doing to my body that entire time, right?
And
With all of that dairy.
Dairy is so common to have a sensitivity to.
Right. All right. It is. Awesome. All right. So what would you say, in getting more into working with the functional stuff, what do you have any highlights or anything that you want to just spread to the community as far as what you're trying to do? And you said you became more passionate just working with your son, and that's typically why people do things, because they get a reason to do it. Right. So what's your message to the community in regards to hoping to get and help more people?
For me, the younger we can start treatment for children, the better outcome we're going to have, because guiding growth is easier than fixing it.
Right. As the twig is bent, so shall the tree grow, right? And there's probably, I know that there's multiple things that we can do for quote unquote treatment, right? Whether that's just finding that sensitivity and getting off that certain food, or whatever it might be. And then getting back to this paper here, it's looking at both the spine and the myofascial development and trying to get things handled. What are some of the more conservative treatments that you're doing in the office, and what are some of the more maybe drastic things to really try to help the people that are, lived a whole lifetime with this and they're finally trying to get it fixed?
So for young children, I'm using a appliance called the Myobrace. And it's an appliance that they sleep with at night, and they use it for an hour or two during the day. What I like about it is that it's a fairly passive device, but it holds the cheeks out of the way. It promotes proper lip posture, proper tongue posture, and proper swallowing patterns.
Nice.
And those are things that don't happen when we breathe through our mouth. So I have my son using a Myobrace, and my 2.5-year-old daughter using one.
Now, is that along with the Myomunchie that I've heard about? Is that the same, or is that different?
It's similar.
Okay.
The difference with the Myomunchie is it is more of a functional appliance that children are meant to actually put in their mouth, breathe through their nose, and chew on it. And they chew on it working up their amount of time, because when you start with it, most of the time their jaw starts to get tired fairly rapidly, because our diets have gone from hard nuts and
from
leathery meats.
Carrots to bread.
Yeah.
Right. Yeah. Okay.
So they both work. And you can use both of them together. Now, obviously, they're two different companies developed with similar developments, though. I have a Myomunchie for my son because it's easier to put him in a Myomunchie during the day and have him chew on that thing for 15 minutes than have him use the Myobrace for 2 hours during the day.
Got it. Now, are these, the Myobrace, the Myomunchie, are these things more for children, or are they more like for teenagers, adults? Can they go up that way, or is there something else that you would do?
You can't. Myobrace does have a line that graduates to older treatment things. For me, though, I use a different system, though, when the kids are a little bit older. So the 9 to 12 year age, 6 to 9 year olds, we're doing a little bit different for them. And that appliance is a removable guided growth appliance for children. And then for adults, I'm using a fixed version of it.
Okay. More of kind of like is it removable as well?
The adult version doesn't come out, and even though it's the child one that I'm using says in the name removable, it can come out, but we want them wearing it 24 hours a day.
Got it.
We want them functioning in it.
Got it. Would you say that this is something that probably just with today's diet and, for most people, do you think pretty much all kids could do it preventatively just to help that function?
Something like a Myobrace especially is not going to be harmful at all.
Right.
Because
it's going to help.
Yeah, it's not going to hurt them because it's promoting proper function, proper breathing, and tongue habits. And you're not going to get a negative effect from that.
Got it. Interesting. Coming back to the research, when we talk about funding and things, we always talk about, especially in the small community of the upper cervical chiropractic world, funding's always an issue. But looking at this research and kind of getting that link between the upper cervical spine and occlusion, what would you recommend for next step in research? Like, if money wasn't an issue and resources weren't an issue, what would you say? What would you like to see in regards to some evidence?
It goes hand in hand with the bite and the airway, because if your airway is too small, you posture your head forward to make it bigger. If you posture your head forward, you're going to cause neck problems.
Right.
So as soon as you start doing that, I'd like people to show more of the links between what happens between your neck and your airway when it's too slow.
Got it.
We know that if you bring your head forward 1 inch, so if you posture forward naturally 1 inch farther than where you're supposed to be, you've doubled the weight of your head.
Yeah. It's crazy. I love the analogy of holding a bowling ball. You hold it like this real straight, and then just move it 1 inch forward and see how long you can hold it there. Exactly. Right? And we got this bowling ball on top of our head. So yeah. All right. Cool. Anything else? Anything else you want to, talk about with what you're doing in practice or anything like that? Anything you want the community to know?
I think the most important thing is that for parents that have kids with ADHD or ADD, have them get tested for sleep apnea, because 70% of kids diagnosed with ADD and ADHD have a sleep breathing disorder. So it may not be related to their bite, but there could be something going on, because if you don't treat it when they're young, then you're not going to be able to overcome the neurological issues as easily.
Are you doing sleep studies in your office?
For adults, what we do for sleep is I have a home sleep test that we send out. We have patients do. For children, a lot of times they have to do in lab. It just depends. There's not as many. I'm looking at different products for home sleep tests for kids, but it's one of those things that we can always put a child into a Myobrace if they're having these symptoms and see if we can affect their sleeping habits.
Nice. Real cheap, easy way to just boom, get it. It's not going to hurt anything. If anything, it's going to help. Let's see if this actually helps, right?
Yeah.
Yeah. Awesome. Awesome, Doc. Well, thank you for your input on the research, and thank you for your time. We'll get this up. I'll put all of your info, your practice info, and everything in the description on the YouTube channel, and we can get it out to the community and let them know what you're doing.
Thank you very much.
Absolutely. Thanks for your time, Doc. Talk to you soon.
Bye.
Awesome. Okay, that's it for this episode. So what did you learn that fascinated you or surprised you about the research today? Join or start the conversation in the comments below. Hey, thanks so much for watching. To watch more of our research shows, click or tap the screen right there. To subscribe to the channel, click or tap the screen right there. Until next time, I'm Dr. Kevin Leach with the Upper Cervical Chiropractic Research Show, bringing awareness to conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic. Until next time, take care and take care of your spine. It's the only one you'll ever have.